Um, it's good to have all of you on board, and we're going to be talking about. Okay, let me just close all the notifications. Right, so we're good to go. So, I'm Dr. Iffat. I'll be your mentor for your reading and your listening part. We've been doing this since the very, almost 7 months, yeah. So approximately around 7 months back, we started this OET program to this Med Exam Expert platform, and it has been a huge success so far. Um, we've had we've had people come across from all over the world, and they've all been very happy with our teaching methods and with their results. There were a few who basically started this OET preparation, and they even appeared for the exam without any sort of guidance, right? But they ended up not clearing their exams. So they rejoined our sessions, and then with the proper guidance and with proper facilitation, they were all very excited with the results, because they all passed with flying colors all of their 4 subtests. So this exam is like it's a high stake English language proficiency test, and it requires along with appropriate knowledge, it requires guidance. And if you're going to work hard with appropriate guidance and in the right direction, then only you can basically score well. Okay, so it's important. You all must be coming from different countries. You all must be very high end professionals. But when it comes down to this test, this just requires a bit of hard work. I know most of you would be from the healthcare settings where taking out some time would be a bit difficult, but that's what we always say, that, just taking the classes that we're giving you would not be enough. You need to also practice on your own, right? So we're here for guiding you and for helping you out and for correcting you all your mistakes, all the issues that you're coming across, but you need to practice on your part as well, right? So I'm sure by now you all must know what the OET exam is. Basically, it's an English proficiency language test, like IELTS, like any other English language test. The difference is that, when we talk about IELTS, that's not very profession specific, right? So we're all from the healthcare settings. Some of you would be doctors, some of you would be nurses, pharmacists, physiotherapists. So when we go for IELTS, that exam is very not specific to our profession. So that can come from anything. They can give you a sort of an economic graph. They can talk about maybe engineering over there. They can talk about anything, right? So that's a very vast platform when we talk about IELTS, right? And because we are from the healthcare setting, and we are applying to places which need to know how our basic English skills are. We need to be more specific so that we are on the safer side, and get our required score easily. And we all must be working, no matter which country we're from. We all must be aware of the basic English skills, right? And we would be working in an English healthcare setting. But since it's not our native language, we need to give a proof to our registering whatever board, or registering whatever place we're applying to, that we can do the work in English. That's why we go for these particular exams. Now, IELTS being vast, we have a better option available, that is OET. And OET is more specific and more easier. It's very easy to score, get the required or desired score in this particular exam, and it's more specific from what we expect in our normal healthcare setting, and what in general we're going to expect when we be working in maybe England or any other place where we dream to work, right? So it's more related to us. That's why it's better, if you're confused which exam to opt for, it's better you go for the OET exam. Okay, right. Next, we're going to talk a bit about, I'm just going to give you a brief overview initially, and then we're going to talk about how to book this particular exam. So this exam is basically designed to assess your communication skills. The basic communication skills you need to basically work in a English healthcare setting, right? So it's important, if you want to work, if you want to study, if you want to just register somewhere to any organization, like maybe the Royal College, you need to give them a proof that yes, I have the basic communication skills required to be a part of your organization, or maybe to be a part of your institute for studying purpose or anything, right? So it's important that we, in order to get that thing, we need to be aware of the basic test format and the construction of the test. Okay, so this particular test has 4 subparts. You have your reading, listening, speaking, and writing. Okay, now speaking and writing is like, you'll have it's not further subdivided. So you'll be having a speaking task where there's going to be an interlocutor, someone would be there, right? And you're going to be conversing to him. You'll be given a few points in the form of some flashcards would be there. You'd be given some points on it, and you have to basically talk to that particular interlocutor, and your whole thing would be recorded, and then the assessors would be someone else. So your recording would be sent to the examiners, and then they're going to assess, and then they're going to mark you, right? So that's your speaking part. Writing is also like this, that you'll be given some notes, and then you have to basically with the help of those notes, you have to write maybe a recommendation letter, or maybe a transfer letter, or maybe different sort of letters are there. So you have to, any of the 3 letters that are basically there in writing, you have to do that. Now, one thing important over here is that writing and speaking, they are healthcare specific. Sorry, they're profession specific. By profession specific, I mean that, if I'm a doctor, so I'm going to get, for the speaking part, the station that I'm going to get, the notes I'm going to get would be specific to my profession. Okay, so I might have a patient sitting in front of me, or maybe another consultant that I'm talking to, right? So it would be specific to my profession, that is, I'm a doctor. But if I'm, for instance, if there's a nurse, or there's a physiotherapist, or a pharmacist, so the scenario would be similar to their cases, okay? So that's why speaking would be different for every healthcare profession. The total of 12 professions that can take, so that total of 12 professions that can basically give this exam, and speaking and writing part would be specific to each profession. So if you're a nurse, you'll get the particular nursing scenarios for both writing as well as for speaking. Similarly, if you're a dentist or a pharmacist, you get your own specific things, right? But reading and listening part, they are same for everyone. So all the 12 professionals who are going to apply for this OET exam, all of you are going to get the same reading and listening part, okay? Because in reading and listening, they're not judging your ability to they're not checking whether you're aware of the knowledge or terminologies regarding anything, right? But they're mostly concerned with whether you can in general read and listen. Okay, so they're checking your English commitment. So you need to be clear about this, that even if you're a nurse or a doctor or a pharmacist or anyone, your exam would be similar to what a doctor would be getting, or what any other healthcare professional would do. Why? Because they're not checking your terminologies, they're checking your English skills, right? So it's important you know this. Then the reading and listening part are further subdivided. Reading is further subdivided into 3 parts. Listening is further subdivided into 3 parts. Okay, so you have almost an RR for both of them. So reading has further 3 parts, listening has further 3 parts, and the audios or the reading material that you're going to get would be same for all 12 healthcare professionals. Okay, so it's important that you are aware of this basic format. If there's any confusion so far, you can ask me right now, and you can stop me in between. No questions? Should I continue? Okay, now one thing that you all need to be aware of is that whatever whatever organization, or maybe whatever your purpose is for OET. Like some people, they give OET as their beginners, like me, they would go for OET because they want to give their plabs, right? um, or maybe some other exam. But some people who are at the higher level of their professional career, they would give OET for registering to any organization, maybe the Royal College, maybe any other particular organization, maybe the Australian Council, or anyone, right? So first identify what your purpose is, and I know by now you must all know what your purpose is. Then the second important thing is that you know what are the rules and regulation of that organization where you're registering, or what purpose you're applying for. You know that, okay? Every place, you know, like we know that for PLAB, we need a minimum of 350 in each of the 4 subtests. Okay, so then that score is, you know, acceptable for us. And for, if we talk about IELTS, we need a maximum of 7.5 band in each of the 4 subtests, right? So similarly, if you're applying at a different stage, at a different organization, there are rules and regulations that are available on the website. So you need to be aware that how much of a minimum score you require in each subtest. Okay, so that information you're going to get from the required desired counselor where you're applying, right? So first clear this thing out. But most of the places, usually for OET, they require a minimum of 350 in each of the 4 subtests, right? Then we talk about the registration process. So before we talk about the registration, remember the three basic things that you can go for the OET. There's OET that you can take on paper at a test venue. That's the most, I can say, the most preferable or the most convenient sort of a test that you can take, right? So you have 3 options that you can register for. You can register for OET on paper at a test venue. Secondly, you can register for OET on computer at a test venue. These are the most preferred options, okay? They're the most desirable options because you are not responsible or concerned with anything. You just have to book your test and go to the test venue and just give in your test. The entire administration of that venue is responsible for your conduction and everything. The third option is OET at home. I would not recommend this option unless or until you have a lot of, you cannot go to a test when you're in a place where it's impossible for you to go out, or there's some other issue, right? Because in that case, it's your responsibility to make sure the entire thing is being conducted, or there's no sort of technical issues that are occurring while you're giving your test, and that can be a headache, right? So it's important you book a test which is there at a venue, so that you just go to the venue, and the venue people have to take care of the other things, and you just have to take care of your exam. Okay, important, right? The first step would always be registration step. Okay, so I hope okay, so I hope you can all see the screen now. Right. So the first step, like I said, was determine what you need. By what you need, I mean is that you go to that desired council and see the rules and regulations, that how much of a minimum OET score they require from you, and you know the basics of that. Okay. The next step would be choosing the OET test date and location. That is your booking part. Okay. We're going to talk about the booking part, but it's important that you know what are the different things, or what are the different sort of prerequisites that you need before you go for the booking part, right? The first thing is that you need to have a personal email, right? A current personal email that you basically use often, a professional email that you have developed for this purpose, for your basic official needs, the email that you're using and that you check regularly. Please make sure you have that and you use that while you're applying. Okay, that's the first important prerequisite that you need before you go for the booking part, right? If you have any issue, you can stop me in between and you can note these things down, right? The second important thing that you need would be a valid ID card or a passport. Okay, now remember, this document is very important. Whatever document you're using, for instance, if you're using your ID card, then make sure you take that same card to your exam center as well, right? If you are booking with an expired ID card and maybe you renew it, that is not acceptable. So make sure you have a valid ID card or a passport with you that is not expired, that is not close to expiration, and that you can take to on the exam day as well. Now, for instance, if you have used your ID card for booking, but you end up taking your passport to the test venue, or you've booked your exam with the help of your passport number, and you end up taking the valid ID card to the test venue, you will not be allowed to sit in the exam. Why? Because there'll be discrepancy in the two documents, right? So whatever document, whether it's an ID card or a passport that is valid, which you're using for booking your exam, for registering for the basic step, remember to take that same document with you on the exam day, right? Otherwise, you won't be allowed to sit in the exam. Okay, I hope this point is clear. This is very important. A lot of people don't know this point, so they end up taking the wrong documents, and your whole OET ends up messing, and you wouldn't want any sort of technical or administrative issues on your exam day, because if you start your exam with such issues, you will not be able to focus or concentrate, right? And you'll end up wasting your time. So make sure your basic documents are complete, and whatever document you're using for registering or for booking, you take the same document on the exam day, right? Now, so this is what you're going to do on Google. When you're going to any sort of a browser you can use, and you can write OET exam booking. They're going to direct you to this particular format, this particular page, right? You have to go to the occupationalenglish.test.org website, okay? And then there's an option of book, which you can see on the right upper hand corner, right? When you're going to open that, this particular thing is going to pop up. It's going to say which country would you like to take OET in, right? So it's important you choose your test venue and your country very appropriately, whatever place you're trying to give. But it's also very important that you know that all the test dates that you're thinking that that every venue or every test would be available. That's not the case. A lot of the times the test dates and venues are very occupied, so make sure you have enough leverage, you have enough space or enough things before you basically appear for any particular exam that you're appearing for. You have enough dates, right? So it's important that you do this, okay? Is basically offered in 40 countries around the world. And if you live in a country where there's an OET test center or more, that's good. However, if you don't, then you can also go to a nearby country, and over there you can also book, or maybe a city. If it's not available in your city, you can go book in any other city as well, right? These are the 12 professions that can basically register under the OET. If you're a dentist, dietitian, medicine, doctor, nurses, occupation therapists, optometrists, pharmacists, physiotherapists, podiatricians, radiographers, speech pathologists, veterinary scientists, anyone from these 12 professions, you can basically give this exam. Okay, this is your next step. So when I was taking a screenshot of when I was booking, since I live in this particular place, the most the suitable or the nearby test venue came over here. So when you'd be doing on your own, you'll see a list of different sort of venues in front of you that's going to pop up, okay? And then you're going to be directed to this particular page. Now in this particular page over here, you have to put in your you have, there are two options. One is login, the other is register. So you have to register, okay? When you're going to register, the whole document is going to appear in front of you, which is going to say that put in your picture, put in your required particular fields. You have to fill those fields, the basic fields regarding your name, your occupation, your family name, your parents, your father's name, and then your ID, your passport, and all those things are going to be there, okay? So make sure you look for an OET test center that's near you or at a place that's convenient to you. You have to look at all the test dates that's available and then choose the one that suits you the best. And at least select at least 3 dates for your OET test, because maybe there's a high chance that the first date that you're booking for is not available or gets occupied. So you have enough dates, or you have 2 more slots available, right? So it's important that this is how you register. So these are the information that's going to come in front of you, right? So there's a given name, there's a family name, date of birth, profession, address, your middle name, gender, your picture. It's important that you upload the most latest picture that you have, okay? And all the other details that you have to. So make sure you're putting in this information appropriately. So after you've registered, you're going to be directed to this page. And then you can basically put in your picture will be uploaded over here on the left hand corner. Your name, your number, your date of birth, your address, everything would be there, right? And then you have to basically, this is your dashboard that's going to pay. You have to go and apply for the test option that's on the top, and then you'll have to choose your profession. The step 1 would be your choosing profession part. So make sure you choose your profession appropriately. Then your test type would come. In the test type, you have 3 options: OET on paper at a venue, OET on computer at a venue, OET at home. So make sure you choose the option that's most appropriate and best for you. OET on computer at a test venue is also very suitable, and OET on paper at test venue is also very suitable. If you think you're a paper person, then go for a paper one. If you think that you're a computer person, you can type fast, you will not have any issue operating the computer or anything, then go for the computer one option, right? And then your country and your venue would appear, right? That's important. The next step would be your selection of date. So over here, you have to select your date. Whatever dates are available, just choose that, right? And then you go on to the next step. The next step would be your venue. And if you need any special arrangements, you can also put in that over here. If you have any special needs, you can also choose any of the options that are available, and you have a list of venues that are available in front of you. So make sure you select the best appropriate or the nearby or convenient venue for you. Right, and the last step would be your review and payment option, right? So make sure you use a valid card for payments, and your entire payment thing would be over here. There are three basically payments that ways that are accepted by the OET people. There's credit card, MasterCard, or Visa that you can use, a bank check or money order, but you need to mail this to the OET together with your online booking form, right? And you have to email it to this entire check to the OET postal address that's there. And party payment is also available, but for a place where the government or any organization is booking you on their behalf. Okay, so like I said, if your question is which one's better, OET on paper or computers, like I said, if you are a paper person and you're convenient with having a booklet in front of you and writing down things, having a pencil in your hand, then go for the paper option, right? But most of the venues these days are offering only computer-based options. So if you're convenient, and if you're if you're okay with using a computer, if your typing speed is good, if you know how to go, use the basics of the computer, then go for the computer based option. Okay, because everything would be right in front of you. So it just depends upon you. Basically both these tests, computer or paper, would not have any effect on your exam results, right? So anything that's more suitable to you, that you're convenient with, you can do that. OET at home is not valid. As far as I know, last time I checked, there were just a few countries where they were offering OET at home. Those countries were, I think it was Palestine, or maybe any of the two other countries. I think it was Iran or Iraq, I'm not sure. But there were 3-4 countries where they said that the venues are not available. So those people can either go to the nearest country and book an exam over there, or they can go for the OET at home. But they're not offering OET at home and to large number of countries. That's what I know so far, right? So these are the 3 payment options that you have in front of you. Make sure you have a valid MasterCard or any other card that you have. And if any organization or any government department is booking or paying on your behalf, then they can use a third-party payment, right? So this is important. Another few details I would like to, okay, so remember your email, the professional email, the one that you're checking very regularly. Use that when you're creating your My OET login, and you should check your emails regularly. Sometimes the emails can go in the spam and junk folder. So you have to be aware of that. Yes, you can pay through the debit card as well. Right? And you have to add in your correct information details when you're registering. Remember the valid passport or ID card, any document that you're using, you have to basically take that same document on you for the exam day. Okay, if for instance there's a question that maybe I booked with an expired document, any document that was not expired at that particular moment, but later on near to the exam date, my document particularly expired, my ID card or passport card. So in that case, what should I do? This is a very valid question. A lot of times people do that. So first thing is that always don't go for any document that has the expiration date very close, right? Because that is just going to mess you up and mess the exam thing up as well, and also mess the OET people. So make sure you have enough expiration or enough days left for your expiration by the time you're applying for the exam, and the same document is valid. In case you do that, you can always email the OET people. They have this email available on their website, that is occupationalenglishTest.org, and over there on that email you can tell them that I booked with this particular document, it expired, this is my new document. You have to give them a new document, and I'll be bringing this along on the test menu. So they're going to respond to you, and they'll basically appreciate that you've informed them beforehand. Okay, so that's important, right? And
so what about your schooling?
If you haven't gone through the testing,
Not
like
yet
if you haven't
starts.
appeared for your
I've
test,
not
then
yet
you can defer your
registered.
test, right? At any time, including the day of test, and your fees will not be refundable. But like for instance, if you do not go for the exam, right, you haven't deferred it and you just don't show up on the exam day, then that will be considered as an absent. So in that case, if you are giving them a valid reason beforehand that I won't be able to show up for this exam and I have this, or I wasn't able to show up because of this reason, then they will accommodate you. But if you don't end up with a reason, then obviously you won't won't get another test and you'll have to rebook your exam with the new fees as well. Okay, so this is important. And another important thing is that once you've booked your exam, you're going to receive, if you're booking OET on paper at test venue option, then you're going to get an invoice or an email, and that particular email is going to contain the whole timetable for you. Okay, so on that timetable, remember to check your name and address. That's very important. All your personal details need to be very relevant and appropriate so that you don't have any ambiguity or any discrepancy in your document. Second important thing is the timetable would be listed. The timetable is the time is like what is the schedule, what you're going to, how your exam day would be conducted. Most of the times you always start with listening, then reading, then writing, and then speaking. But and it's important that you check your timetable carefully so that you know before going appearing for your exam or on your venue, you know that which will be my first subtest, the second subtest, third test, so you orient yourself according to that. Okay, so it's important you visualize your timetable very carefully. Okay, and your test venue would also be written, right? So the test day schedule would be sent by the venue people to you. This is a third document that they're going to send you, the test venue people. Okay, they're going to give you a test day schedule 1 week prior to your test. So make sure you are looking at all of those things very carefully, right? And if we talk about the OET on computer one as well. So another important question that a lot of people have is that sorry, what is your question? Can't understand when consider absent. No, I was saying that, you know, if you've registered for, if you booked your exam, right? Suppose for instance you booked your exam on Monday and you are unable to you don't go to that exam, right? You have two options. One, you can defer your exam. Defer option is available. Okay, but if you haven't deferred and you don't end up showing on that exam, you will be marked absent, right? So it's important that you give them a valid reason, right? You have to give them a valid reason that, okay, maybe I had this particular issue because of which I was not able to attend the exam. Then they can accommodate you in some other test in the next test, right? But if you don't give them a reason and you just end up being absent, right? So you will not be accommodated. You'll have to rebook your exam. I hope you're getting the point. There's a difference. One option is deferring option, that you know I won't be able to show up for the exam, so you just defer it to some other test date, right? Second option is, you, for instance, there's some sort of God forbid, a very big a sudden sort of an issue, right? And you're unable to inform the OET people before your exam, and you're unable to defer it, right? So after your exam, you can basically, after the test date goes by, you can basically give them an email, write them an email and tell them with a valid reason, with proof that this happened to me that day, so I was unable to show up for the exam. They will accommodate you in the next dates. Okay, and you won't have to pay for it. But if you don't do that, okay, within 70, within I think 21 to 2 days, within a day, if you don't do that, then you'll just be cancelled and marked absent, and you'll have to rebook your exam. Rebooking means you have to pay them again. Yes, you have to go through this whole process again of selecting the test date, the venue, the payment, everything. So rebooking is basically paying again. Okay, now another important thing is that a lot of people think that, you know, multiple bookings, you know, they can do that. This is not advisable, and this is not considered. Like the organization which you are applying to would basically have rules and regulations for OET as well, that, you know, in a single sitting you need to score this much, or some people also accept multiple sittings, right? That, you know, for instance, in the first sitting you were able to just pass your reading and listening, and you were not able to pass speaking and writing, for instance. So you will take the exam again, and then, you know, go through the 4 subtests, and then basically pass it. So they're okay with you showing results from 2 different tests. Okay, but most of the organizations are not okay with that. So you have to basically pass it in one go. Okay, you can't do like this, that, you know, I passed in my first attempt, I passed these 2 subtests, in my next attempt I passed these 2 subtests. Most of the organizations don't accept that. Okay, so just be clear about what your organization is accepting. Okay, so in the first sitting you have to basically pass all the 4 subtests, and you have to also take the 4 subtests in the first sitting, right? You can't do that, that, you know, you're Yes, speaking module will also be on the same venue and date. Sometimes what happens is that you don't get a date. Most of the times it's not like that, but sometimes the speaking test date can be different from the rest of the three subtests. Okay, so mostly if you're giving your paper-based test, so your speaking comes within, like, within a a maximum, I think, 5 days before or after your initial test, you will get a date, right? But most of the times on the same date you will have to give your 4 subtests. But in case you don't get it, so within 5 days you can give a speaking test on any of the 5 days, either before your original test date or after that, but not more than that. Okay, and if you don't give it within that time frame, you'll have to book your test again, right? That means you'll have to give it again. Okay, is it clear? Okay, and you will get reminders 48 hours before your reading, listening, and writing part. You'll receive an email reminder as well. Similarly, for speaking part, if you don't get it on the same test date, whatever test date they give you, you get a reminder 48 hours before that. So just keep checking your emails. Checking your emails is very important. Okay. And another issue is about remarking. That I some people say that my test went very well, but my scores were not according to the mark, and I did not perform so low, and I failed my subtest. So I want to recheck, get them remarked, right? So remember, there's a fee for remarking, and within 72 hours of your result that's been published or given to you, you have to then appeal for remarking within 72 hours, not beyond that. You cannot, they will not accommodate you beyond that. Plus there's a fee for it, so make sure you have to pay that fee also within time. And whatever marks are going to be issued after remarking, they'll be your permanent marks. So if you say that my first marks were more, and after remarking my marks got less, okay, so your less marks would be the final marks. The decision will not be reversed. So make sure, if you're appealing and if you're considering for remarking, you should be 110% sure that your exam was very outstanding, and they ended up giving you low marks. Okay, you cannot question them, you cannot ask them to give you an explanation about where you were wrong or what part you basically missed. So that doesn't happen. Okay, there's a question. Some they are saying if you pass speaking with C plus, then second time they can add the previous marks. It's true. I don't think so. This is true. I'm not sure. As far as my knowledge is concerned and what I know from the latest updates, this is not how it happens. Whatever, like how much ever you score on that particular subtest in that one booking of the test, that is your actual thing. The marks from previous tests or things, they don't get added. This is not right. But then again, it depends upon, it varies from organization to organizations. So wherever you're applying, you should know what are they accepting. Some people do accept this. Okay, clubbing. About clubbing part, then again, like I said, just depends upon the organization. NHS or they don't accept clubbing. Okay, as far as I know, if you're applying to the NHS, they don't accept clubbing. They want you to get the desired score in one sitting. So you will not be able to. They will not accommodate you if you're getting two scores from two different tests in time, trying to compensate and trying to you know uh, uh, make a cumulative result out of that. Okay, so they will accept your scores from a single test that you're basically giving. Okay, so it just depends upon the organization, and it just doesn't accept that. GMC, sorry, GMC people do not accept clubbing. Maybe the criteria is different for the other professionals wherever you guys are applying, but for doctors, as far as I know, GMC doesn't accept that. I'm sure the Royal College people don't also accept that, because they want you to score and pass in one go. Okay, highest failure rate in writing. I think writing is not for doctors, as far as I know. writing is not the highest failure rate. A lot of people find reading and listening very difficult, and contrary to the most popular belief that you end up failing your writing, a lot of people they end up passing writing, because writing is not very difficult. There's just a few, there's a basic criteria. There's just a few points and a few words that you need to just remember and incorporate, and there's just three sort of letters that always are repeated. The same pattern is followed. So writing comes out to be very easy because we're all in practice, in our normal lives as well. We're in practice to writing and everything. But the thing that we lag behind is listening part, or maybe reading. We're also, regarding the reading part as well, we're also somewhat in practice, but listening and reading is something that, because we have a very shortage of time in that case for reading and listening subtest, and the audios are very general. They can be from any profession. Writing and speaking are more profession specific. Reading and listening can be from any sort of profession, whether from a nutritional setting or a pharmacy setting or physiotherapy setting. So a lot of people end up failing that. So that's what I know from the previous experiences, that it's the reading and listening part that you end up losing marks in. And since there's three parts to it, so it's very difficult to score absolute marks in all three of them. So that's important. You have to score 37, I think, out of 42. Sorry, 30 out of 42 for a B in reading and listening. Okay. Yes, listening is very tough. Listening ends up being very difficult because the first and second part of listening subtest is somewhat easier. The third part for reading and listening both is very difficult. It's very general, it's very long, and you don't have to basically you have to do it in a very short amount of time. So time can constraint is an issue for both reading and listening, and that's why you have to be very fast and practice a lot. So any other question or query? I hope this session was useful for you all. Okay, so I would like to know if you have any other questions or queries, any concerns, anything you want to ask in today's session. It's just a sneak peek of what we are going to basically tell you. This I'm sure you guys must have learned something from this session, and if you're going to enroll in our July session, the things are going to get more. They're going to get more streamlined and more. They're going to make more sense to you guys, right? So we have separate sessions for reading, for listening, for writing, and for speaking. So it's important that you prepare with the right bit of information and in the right direction, right? Because otherwise, if you're just preparing from different online sources, sometimes information is not valid, or it's not very similar to what you're going to expect in the exam. And plus, you need to be sure, and you need to also know you prepare from the examiner's point of view, right? So it's a simple English language test, but can get tricky and hard if you don't have the right guidance. Okay. So your exam is in 14 days, right? It's on 9th of July. Okay, so you have you're short of time, but it's okay. If you want to prepare through the med exam to the med exam expert team, we can arrange special classes for you so that we can get you prepared in these 14 days. But if you want to do it on your own, then obviously I'll recommend that focus on your practice a lot. Make sure you're using some reliable resources online. Practice your writing and speaking part. If try doing the sample papers on the OET's website, right? But it'll be better if you join a particular tutoring sessions so that whatever you're preparing is in the right direction. So if you want to join our sessions, we can accommodate you and try to prepare you in these 14 days. Okay, so how can you join med exam for OET classes? So that information Ms. Anam is going to give you. She's the coordinator for the OET sessions, and she'll tell you about how you can basically join us. If you talk about the fees, I'm not sure about the fees. She's going to inform you about the fees as well. The duration of classes is usually around 1 hour. So like the session will not prolong. It'll be maximum of an hour or maybe an hour and 20 minutes, depending upon what exercises we are practicing and how much concerns are there from your side, right? So that's important. And Since you're saying writing is a problem for you, so writing comes with practice and with appropriate guidance. We have a whole list of letters that can come for you and the pattern that you have to follow. So it's better if you need that guidance, you should contact our team. We can give you the whole list of the letters that are expected, the format, the words that you're supposed to use, how the examiners are going to assess you. So all of that would be, you'll be okay. If you talk about listening, so yes, listening can be an issue. For listening, I would suggest that, whatever, there's this, on YouTube, there's this Learn Easy English, I think something of that sort. There's this resource that's available on YouTube, right? Learning English or BBC Learning English, right? So this is a resource that you can use in for listening. I always advise people to, first listen at a slow speed and then try to increase the speed, so that way you'll be able to, listen at a at a uh, at a very fast pace as well. Secondly, it's important you read the transcript. By transcript, I mean subtitles. So whatever you're listening to, make sure you have the transcript or subtitles for it, so that you know which part, the part that you're unable to listen, how it's being pronounced, what was it, and it's right in front of you, right? So it's important you do that. And listening comes with practice. So whatever you're looking at, or whatever, if you're watching a movie or a season or anything, just make sure you look at the subtitles so you know how things have been pronounced, because speed and accent are two important things that are basically going to hinder your listening. Plus, you should know about the basic format of the listening subtest, that what are you being assessed for in listening part A, what are you being assessed for in listening part B, what are you being assessed for in listening part C. So part A is mostly detailed listening, right? B is mostly just reading, and C is mostly opinionated, or you can say inferential listening, right? So this is with the basic examiner point of view assessment that you need to know, right? Because if you're just listening in general without any guidance or direction, you would just be listening, okay? You would not know what the examiner is trying to assess, and you will not be able to score. So it's important, what are they assessing you for. So A is different, B is different, and C is different, and that's why they all have separate marks. They have separate timings, they have separate tips and tricks to do them, right? So it's important. Okay, so timings of classes are very much flexible. We have recorded sessions. In case you're unable to join our session, the recordings would always be available to you. And we have a WhatsApp group. So if you miss the class and you look at the recording and you have a concern or a query, so all the mentors are available on the WhatsApp groups. So you can ask us anytime, whatever question, query, or issue you have. So the timings are very much flexible, and everything is for you guys. We're very accommodating, right? So we can accommodate any one of you. Where can we have practice this method? We have, okay, so med exam expert team we have developed a practice test as well for you. Plus we have an OET mock exam as well, which is very much similar to the actual exam. Okay, so we have a whole list of on our website. We have this OETs, for every subtest we have extensive, on practice tests that are available. Plus we also practice tests in our sessions. So if you want to do practice, then we have lots of practice tests that are available. And plus our OET mock exam test is very, very much relevant if you have an exam approaching close. So it's important that just a day or two before your actual exam, you do that mock test, and then that test will give you an idea about where you're standing. And it's very much, it will make things very easy for you. Okay. It's very much like the real exam. Okay, so course coordinator is Miss Anam, and she will basically coordinate with you. She will, whoever is interested in enrolling, you can contact the med exam expert team. They've put in the website as well as the phone numbers for you, the WhatsApp numbers as well. So they're going to contact each one of you and try to, get you in the sessions. Any other question? So I hope this particular session gave you some insight about what to expect in our sessions and how we're going to facilitate you. Remember, we'll always make things easier for you. Okay, so we're here to give you a flexible schedule. We'll provide you with some, if you want one-to-one sessions as well, we can accommodate you in for that as well. If you want group sessions, if you're interested in that, then we can also accommodate you in that. Okay, if you have an exam approaching very near, we can arrange some special sessions for you. But if you don't have an exam approaching, so you can just join our group sessions. Okay, our sessions are all recorded. If you enroll in our sessions, we are going to provide you with a list of all our recordings, all our practice test, mock exam, everything would be available to you. Okay, and you can access that at any time of the day, any place, anywhere, right? So our sessions, the mentors are all basically recognized by the OET people, and we are here to facilitate you. We have been doing this for the past 7 to 8 months, and we have been getting some exceptional results. 100% passing result is there, right? So if you want to prepare with the right people and the right direction with appropriate guidance, and you want to pass it in one go, and if you want to know what are the basic tips and tricks to go for each subtest, then this is your place. Okay, so just join the sessions and we'll be ready to help you on. This recording of this session will also be provided to you. Okay, so any other question or query? Okay, so I hope I made some made things easier for you, and you got some sort of orientation from this session. And I'll be looking forward to seeing you, most of you, in our July session, right? So it was lovely to have you all on board and to interact with you and to answer your questions. We're going to be answering more of your questions and queries, and considering to make sure you all pass your OETs with flying colors. So just, yeah, thank you. No problem. It was lovely to have you all.